The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
When we think of our Canadian Armed Forces, we don't necessarily think of them being deployed here at home. But when COVID-19 hit long-term care residences, they stepped up. Tonight, as we remember all the different kinds of service that our military men and women undertake, we'll hear about that most uncommon mission. Then, what does it mean to recall, honor, and acknowledge the service of those who went to war in Canada's name, even as our views of history evolve? We'll reflect on that. It's Remembrance Day, Wednesday, November 11th, and that's tonight on The Agenda. During the most devastating phase of the pandemic's first wave, long-term care homes in this province were in such dire straits they required the assistance of the Canadian military. Their efforts on the home front were critically important to caring for residents. Their subsequent report on what they found in those homes shone a light on some devastating conditions. With us for a broader view of what was involved, we welcome, in the provincial capital, in Upper Forest Hill Village, Lieutenant Colonel James Stocker of the Canadian Armed Forces, who was commanding officer of Territorial Battle Group 1 when it was sent in to assist. And in Hamilton, Ontario, there's Corporal Leila Ahmed, Canadian Armed Forces medical assistant and a registered nurse deployed in the effort. And we're delighted to have you two with us on this important day on our calendar. I just want to start by, let's take everybody back. And I want to remind everybody about what Operation Laser was all about. It was the Canadian Armed Forces' plan to rapidly respond to the pandemic, in this case COVID-19. And let's bring this graphic up and we can tell everybody what went on. In April 2020, the Government of Ontario asked the Government of Canada to send Canadian Armed Forces in to assist in long-term care facilities. From the 28th of April to the 3rd of July, 500 soldiers were deployed to 7 long-term care homes in the Greater Toronto Area. Groups included both regular forces and reservists from the Army, Navy, and Air Force, and approximately 50 soldiers per facility were brought to bear. Lieutenant Colonel Stocker, let me start with you. Did the soldiers know what their mission was before they were actually deployed?
A quick answer, Steve, no. So in the initial phases of the COVID pandemic, a decision was made to form a rapid response versatile unit, which was capable of responding to a range of emergencies that the province of Ontario may have need of us. And we formed a unit known as Territorial Battle Group 1, which was a composite unit, and deployed that unit in segregation to Borden to be prepared to respond again to a wide range of emergencies. Now, this could have been a COVID type emergency. It could have been a flood or a forest fire. And so we trained for a wide range of contingencies. And at the end of the day, of course, the ultimate task selected in response to a request for assistance from the province was a task to provide that emergency support to those select long-term care facilities in the GTA.
If they didn't know what they were being sent off to do, what did they think they were being sent off to do?
The Territorial Battle Group 1 mission was one of readiness and to be ready to respond to a range of contingencies. And like I said, likely tasks included floods or forest fires in communities which would have already been stressed by COVID. And these communities have fairly small emergency management departments, and they might have been quickly overwhelmed in light of COVID. And so we prepared for a wide range of contingencies. Again, northern evacuations, floods, forest fires, or more of a COVID type response. And ultimately, of course, the COVID response was what ended up coming to pass.
Mm-hmm. And one more follow-up, if I could. Is it fair to say that when people join the Canadian Forces, doing this kind of work in a long-term care home is probably not at the top of what they think the list of things is that they might be asked to do?
I think that's fair to say. It certainly wasn't anything that I anticipated. I don't think it was anything any of the soldiers anticipated. COVID is an unpredictable pandemic, an unpredictable emergency. But what we do train for in the CAF is readiness and general problem solving, and the ability to apply that general problem solving skill set when you plug in the right specialist advice. So even though it's an unfamiliar task for certainly the generalists who worked as general duties personnel, and in fact, I would offer probably a little bit unfamiliar even for our medical personnel who train more for things like trauma, field hospitals, base hospitals and base clinics, we do train that level of responsiveness, that ability to respond to the unforeseen, provided we get the right expert advice. And that really was what we did in TBG1 in the long-term care facilities.
Okay, Corporal Ahmed, when you were brought onto the scene, what were your expectations as to what you thought you would find?
So I'll say it's very similar to Lieutenant Colonel Stalker. We didn't really know at the beginning what we were to do. At the time, I was working both mental health nursing and emergency room nursing. So I was already sort of responding on the COVID-19 front line, if you want to call it that. As they started to sort of look for who would be available to go to op laser. Again, details were still sort of fuzzy. We were ready for whatever was needed. But that being said, the details had not been hashed out at that point. So we were very, very quick moving. The timeline was very, very short because we wanted to get into the homes and respond as soon as possible and do what was best for the residents and as well to aid the staff and sort of help to stabilize that situation.
And we should just say right now, because the background does not really give away where you are, but you're at work right now. You're at a hospital in Hamilton. You're on a break. And we are really grateful that you're taking your break to be with us here. We won't take too much of your time so that we can let you get back to the important work that you do. Having said all of that, during your collective time in these long-term care homes, the military did its work and then wrote a report. And we want to share some of the details of that report. I well remember Premier Doug Ford going to the podium at a press conference and saying this was one of the hardest things that he ever read. One of the hardest reports he ever read. Here we go. You folks saw aggressive behavior from staff towards residents that the military deemed to be abusive, including degrading or inappropriate comments, and refusing to stop or slow down when patients complained of pain. Your soldiers saw medication that had been expired for months. You saw insect infestations, including cockroaches and ants in these long-term care homes, forceful feeding that caused audible choking of patients, extremely severe bed sores, including some that had worn through to the bone. Patients with soiled diapers who were left in their beds. In certain cases, military personnel had to bring their own food to ensure residents were fed, and no accountability for staff who failed to uphold basic care needs. Corporal, I want to go back to you. I get that there's an independent investigation into all of this going on right now, so you are somewhat hamstrung from what you can say. But having said that, what was the state of the long-term care homes that you found yourself in when you were brought in for this mission?
Sure. So I will say that every home was different. Every home had unique challenges. So there was different reasons that those homes were on outbreak. Our goal in mind was to help stabilize that home. So it really was our responsibility not to go in and sort of judge and be punitive, but to sort of support the home. And you would see sort of across the board that there were some staff that had been working for almost a month straight with no breaks, 8 or 12-hour shifts. There was sometimes a lack of sort of infection prevention and control policies that were being implemented, or they were so short-staffed that they really weren't able to. So a lot of it was education, a lot of it was assessment, but obviously we have an obligation to care for people ethically and safely wherever we go and to report up those findings. So while I can't really talk about the specifics of the report, I can say that it is our obligation to care for people and to ensure that a high standard of care is being maintained, and that even once we're gone, that there are policies in place and that the education is in place to make sure that that high standard can maintain.
Fair to say you didn't see much of a high standard at work there?
I would say that you could see there's obviously issues, right? We know that issues in long-term care aren't necessarily new. I would also say that there were staff that literally had risked their lives being there, civilian staff. And so it wouldn't be fair to paint it with one brush to say that no one cared about the residents or that all residents were treated poorly. What issues of concern were brought up and reported as such, but there were also staff there that did quite an excellent job of caring for people and have worked there for a number of years.
Lieutenant Colonel Stalker, I really want people to be reminded of the kind of work that your people had to do, the kinds of equipment they had to wear, the kind of shifts they had to work, the kind of things that they encountered. Could you fill in some of those blanks for us?
Yeah, absolutely. It's a great question. So Territorial Battle Group 1 was formed towards the beginning of April. And from the very beginning, we took a pretty strict stance towards potential COVID-19 infection. So pretty detailed segregation, podding. So if you worked within a certain team, you stayed within that team for the nature of the deployment. Once we pushed down into the long-term care facilities, as you mentioned, towards the end of April, we really broke down into what were called augmented civilian care teams. This is about 50 people per team and one team, roughly speaking, per facility, although there was some room to take into account specific considerations. And each of these teams was broken down into a mix of both medical professionals, nurses, and medical technicians, as well as generalists, we call general duties personnel. And these were general soldiers, sailors, or aviators who opted to take part in this mission. And again, this was a volunteer mission, in particular for the reservists who took part. The medical personnel did things that you'd expect medical personnel to do in terms of direct patient care, whereas the generalists did things like food portering, cleaning, various preparations, logistical help, anything we could do to assist the facility in overcoming this emergency. And in support of them, we had a number of people who worked outside the home, taking care of those who were inside the facility in terms of things like preparing their meals, doing their laundry, and assisting with their accommodations. And this was all part of a broader Ontario, broader pan-governmental response to the crisis.
We should remind everybody, your people were sent in at a time when there was a great deal, a lot less was known about COVID and a lot more fear was in the air. So I'm wondering whether any of your people declined the assignment.
Not a one. We did not have a single individual decline the assignment. You're quite correct. The level of knowledge about COVID was far less now, or was far less then than there is now. There was understandable concern and to a degree a little bit of fear, not only for themselves but also for their families. But not a one declined the opportunity to serve.
And Corporal Ahmed, what kind of personal protective equipment did you manage to get in order to do your work?
Sure. So around the time that we were in the homes, we determined that for the most part, unless there's an aerosolizing generating procedure, that we weren't to be wearing N95s, that droplet masks were to be okay. So we were fit at all times with a mask, with a face shield, with a gown and gloves. Obviously, wearing that equipment and not using it properly also is a huge issue. So a lot of the education that we would do, especially with civilian staff, was to say, okay, this is how you don it or put it on properly, and this is how you doff it. Because as you're taking on and taking off personal protective equipment, that is sort of your greatest area of risk. You kind of get used to it, but you don't really get used to it even after a series of weeks. But it is something now that is both civilian and military. We are using personal protective equipment to protect ourselves and to protect our residents and patients as well.
You can be really candid with me after the fact here, because obviously you got through it. But did you worry at some point that you were going to get this disease and die?
I think, like any healthcare provider and really like any citizen, there is always that concern of worry. But we are given the training, and I've been a nurse for a number of years. I've been an RPN for a number of years. So you're given the training, you understand the risks, and you're outfitted with the proper PPE. So you have the supports in that section. It doesn't mean that you still cannot contract the virus. It still is a potential, but we're human beings, right? You're going to worry about your family while you're away, but at the end of the day, there's a mission to complete and there's people that need help. So we take the necessary precautions, we use our PPE, we wash our hands, we try not to touch our face. It doesn't guarantee that we're not going to get sick, but it gives us a much better chance of coming out healthy.
I mean, I asked the question because I presume you saw a good share of death in those homes. Is that right?
We know that our geriatric population generally tends to be the most susceptible sort of to the side effects and unfortunately has a higher mortality rate for COVID-19. Part of nursing, yes, is caring for our dying and doing so in a compassionate way. So we did have the opportunity, obviously, to help people sort of through the end of their lives in a comfortable and compassionate way. And that's not something that's necessarily unusual for long-term care homes. Oftentimes, it's that person's last home. But we wanted to make sure that whether it was related to COVID-19 or old age or whatever the situation was, they were treated with dignity and respect.
Well, yeah. Again, I'm going to push this one more, if you don't mind, because I do remember many families at this time were expressing just incredible sadness about the fact that their relatives, and I'm not talking about the homes that necessarily you were involved with, but all around Ontario, their relatives were dying and they weren't able to get into their homes to visit their relatives, and their relatives died alone. And that was tragic. So I'm again going to infer that there were moments that you experienced where you may have held somebody's hand as they died, and you were the last person they saw. Is that right?
That is correct, although we would try and involve the families in any way that was possible. So although the risk at that time was too great to allow them into the homes, we would have either phone calls or FaceTime videos. Is it a complete replacement for in-person visits? I don't think so, but we were doing the best we could with the availability that we had and sort of with the safety precautions in place. It definitely is not my first time sort of helping people to the other side and ensuring that they have a dignified death. But it was especially important for us because of the lack of family that we were there to support people sort of no matter what the situation was.
Lieutenant Colonel, I should ask you, did any of your people contract COVID-19?
Yes, Steve, we did have some contraction of COVID-19, and those numbers were released by the government to the media. I am gratified to note the number was quite low, and that everyone ended up healthy in the end. And again, keeping in mind that these soldiers, sailors, aviators, medical professionals, and generalists were working in a higher risk environment. There was some contraction, but at the end of the day, everyone was healthy.
Good to know. Now, for the longest time, of course, during this period, these isolated soldiers and seniors essentially were the only point of human contact that they had in the world. It was with each other. Was there any particular exchange that stood out for you that you can recall and tell us about tonight?
There were a couple of really touching moments, and I've related to other folks. We did have one soldier who took to playing piano in one of the long-term care facilities in his limited time after hours, and you could really feel the mood lift when he did so. That sort of that art touching people. We also had a number of our personnel helping residents build bird feeders to hang outside their windows. And Corporal Ahmed quite aptly noted that isolation was a problem for some of these residents, as it would be for all of us. So the idea of having a regular winged friend come visit you every day, I mean, it sounds like a small thing, but having that regular contact pays huge dividends for mental health. And we noticed an immediate uptick in those cases. So that countless examples of our people adding that touch of humanity, going out of their way to make people's lives a little bit better. I'm incredibly gratified to relate those stories.
Corporal Ahmed, I want to ask you, how do I put this? Don't take this the wrong way, but you are, in all of the answers that you've given us here tonight, you are really name, rank, and serial number. Like, you're really doing it by the book, and I'm impressed with your professionalism and how you appear to be very unemotionally affected by what you had to do and what you saw. And of course, that's what we want in a soldier. We don't want somebody breaking down when there's a job to be done. But I do need to ask whether, when the day is over and when you go home and when the head hits the pillow, whether this has an impact on you.
I would definitely say I'm probably the opposite of unemotionally affected. I tend to put a lot of my heart into nursing and into caring for people. I see a time and a place, obviously, to be able to sort of have that moment to decompress, but the empathy is always there. There are certain residents and certain patients that just hit you harder and that you will always sort of carry on with you. And I haven't forgotten any of them months down the line. And they've also changed the way, now that I've returned to civilian nursing, they've changed the way that I interact with people, of just taking a little bit more extra time to listen to them, to be kind to them, to sort of hear out their concerns. And then as well, sort of introspectively looking at myself and what can I do to sort of make these people's lives better, whether they're 2 days old or whether they're 90 years old. So it definitely has changed me as a person, and it's changed me as a nurse. But it's, at the end of the day, I would say most soldiers, I think, are maybe outwardly what we would say cold, but inwardly are extremely empathetic. And you need to have that to be able to be a soldier. You need to be kind.
Now, James Docker, you served in Kandahar, Afghanistan, which is the kind of mission that I suspect people watching this would expect that a member of the Canadian Forces would undertake. Would you be able to compare that kind of more traditional mission with this mission that you undertook on behalf of seniors in the province?
I think it's a little bit incomparable. Every mission is unique. This mission is perhaps more unique than most, if I can say that. But one thing that these missions all have in common is they relate to the idea of service and putting yourself out there in service to Canada and Canadians. this is, an immediate example of that. And so while this mission, missions in the Middle East, missions in Africa, missions all over the world where Canadian forces, soldiers, sailors, and aviators serve, they all relate to that concept of service. And I think that's what motivates people in uniform.
I would also assume that there were members of these residents of these long-term care homes who were veterans, right? Who served back in the day, maybe 40, 50, 60 years ago, maybe more. And I wonder if your soldiers had interactions with them, and if you have any stories about those interactions, if they took place, that you could share with us.
Certainly. And I think, and quite right, we did encounter folks who are veterans who served perhaps in the Second War or Korean War. And I think what it served to do was reduce a sense of the othering. And especially if you consider some of the soldiers and folks who worked in these homes in the general duties team quite young. And so there's a real sort of separation between them and the residents. And to recognize that there are veterans in these homes, it sort of serves to reinforce the fact that this isn't some distant other. This is us in 30, 40, 50 years. And it was quite extraordinary, in fact, when some of the soldiers found that some of the residents were from the very same regiments they were serving in. So a real sense of bonding took place at that point.
That must be quite a connection.
Very much so.
And I don't know how this works. I know some soldiers don't want to talk about their service, and others are all too happy to tell you about what they did and where and when and so on. Did you have some of those kinds of interactions?
Yeah, there were quite intimate personal connections made between the soldiers, sailors, and aviators, whether they be general duties or whether they be medical personnel, and the residents in the homes, and no doubt a lot of stories being swapped about experiences both overseas and domestic.
Corporal Ahmed, to your knowledge, did you have any vets that you had to care for?
We actually had quite a few on the floor that we were on. It was quite interesting to see their faces light up as soon as, because we were wearing scrubs at the time. I think it's important to note. So we were not in combat. So we weren't immediately identifiable along with our gowns and all of our other PPE. They didn't necessarily know where all of these new staff came from. They just knew that there was new staff. Obviously, respecting patient confidentiality, we did have one gentleman who was in his late 90s who was an Air Force veteran. And it was just as simple as, if we were done the tasks at the moment, one of us would go sit with him and he could tell stories for hours and hours and hours. And at times we would talk to his daughter and she would say, you know what, I've never seen him so happy and so alert. It's nice to know that even though he's alone, he's not lonely. So it definitely is a bond sort of that transcends generations, and that I'm glad we were able to sort of support them in their final years, but also understand to some degree what they went through in their early years of their lives.
So late 90s, he must have been a World War II vet?
He had gone to, yes, he was World War II.
World War II. Okay, I appreciate you're trying not to offer too much identifying information to respect their privacy, and I appreciate that. But I am imagining the joy that they must have sensed once they realized that you too were Canadian Forces, and that bond that must have been created. What was that like?
It definitely is a very, very special bond. And it's something where when we were departing from the home, so once the home had been stabilized, there was a lot of tears shed on both sides because you'd built that friendship, you'd built that mutual understanding, and you'd just spend hours and hours and hours talking and conversing. And you could have the same conversation 10 times and it would still make them very, very happy. So it definitely is something that I hope, if I ever get to that age, that I have someone caring for me and I can make that bond as well.
I'm not going to pretend that this final question for each of you is all that original, but it seems like the right question to ask on Remembrance Day, and that is, Lieutenant Colonel, why don't you start us off? What do you think about on this Remembrance Day?
I think about those who came before me, who served and sacrificed, and how to do in the small way that I can, how best to honor their memory.
And Corporal Ahmed, how about you? What do you think of on Remembrance Day?
Absolutely. So I think of the sacrifices that were made for generations before, whether it's the geriatrics that we were caring for, or if it was, for example, tours like Afghanistan. But I also like to think forward about the future sort of missions that will go on. And we know already that they're not predictable at this point. And I hope that we continue to support Canadian citizens, whether it's on Canadian soil or elsewhere, and that we continue to support Canadian soldiers with mental health and peer support sort of efforts to ensure that no one feels alone, and that we're able to continue on and complete our missions, but also take care of each other and as well as Canada.
Well, I can only imagine how grateful the families that you helped feel on this Remembrance Day, and we're grateful that the two of you could spare some time for our viewers on TVO to let them know about the work that you have done. Lieutenant Colonel James Stalker, Corporal Leila Ahmed, thank you both so much.
Thanks very much indeed.
Thank you.
Our collective memory of war and the soldiers who served their country in those terrible conflicts is not static. It evolves over time. But as veterans age, how long can we remember? What do we stand to lose lest we forget? And how important is the memory of sacrifice to a healthy society? Let us consider that with, in London, Ontario, Jonathan Vance, the J.B. Smallman Chair in the Department of History at Western University. In Niagara-on-the-Lake, Cecilia Morgan, Professor in the Department of Curriculum, Teaching and Learning at OISE, the Ontario Institute for Studies in Education. She's also an adjunct professor of history at the U of T. And in the Trinity Bellwoods neighborhood of the provincial capital, Arn Kislenko, Professor of History at Ryerson University and an adjunct professor in international relations at U of T. And Jonathan and Arn, we're delighted to have you back on the program. Cecilia, nice to have you here for the first time. Long overdue, and we're glad we could get you on tonight. Let us... I want to start by setting up this conversation by reading something from Tim Cook, who, of course, one of our best military historians. This is from his latest, The Fight for History, 75 Years of Forgetting, Remembering, and Remaking Canada's Second World War. Here we go. Over time, a particular form of social memory emerged surrounding Canada's war effort. Social memory is the constellation of thoughts, ideas, and key events that people create and embrace to make sense of their society. Often, this involves forging an agreed-upon version of the past that resonates in the present. The past may not change, but how we view it does. A fascinating observation, so let's get in on that. Jonathan, why don't you start us off? To what extent is our collective memory of war never fully settled and constantly changing?
Our collective memory of everything is constantly changing. War, peace, you name it. This conversation, when you remember it tomorrow, it'll be different than when you remember it a week from now. So it's constantly in flux, relating to issues around it.
Cecilia, do you agree?
Yes, I do. I would say that one of the aspects of that quote that I think would be interesting to pull apart a bit is the fact that people do come together to remember things, but the reasons that they come together may be different. And sometimes the act of remembering also can expose divisions within society as well.
Arn, why don't you give us an example of that? For example, something that may have happened during World War II that during the course of our lifetime we think about or regard differently today than we may have 25 years ago, 50 years ago, 75 years ago, etc.
There's so many examples, Steve, to be honest with you. I think the entire narrative of world wars is subject to that kind of change in interpretation. The way that I was taught, certainly events in World War II is vastly different than I teach it now. It's far more international now. We have, of course, a lot more archival information, the legacy of veterans talking about it, and decades worth of reinterpretation. So for me, I could pick endless things: Stalingrad, the raid at Dieppe. There's a whole, buffet of things that are now different. What it makes the job is very difficult. Sometimes historians, we don't. I think people don't fully understand how difficult the job is because that presents a whole minefield of issues and ideas, interpretations that makes one narrative particularly difficult.
Sure. Jonathan, let's go back even further. Let's try World War I, which, of course, 2 years ago was the 100th anniversary of the end of the war. So there was a great deal of rethinking, reinterpretation of things. Could you give us one example of something related to that conflict, which now we regard very differently than we might have half a century ago?
Sure. I mean, the obvious one is the Battle of Vimy Ridge, which has sort of been a centerpiece of Canadian national feeling for decades. And shortly after the First World War, you wouldn't dream of questioning that Vimy represented the birth of the Canadian nation on the battlefield in France. But now it's I think most people would agree that Vimy was a relatively unimportant victory. and that its main impact on the country was emotional rather than practical. Historians have written of the cult of Vimy-ism. So Vimy has always been enormously important, but it's been important for different reasons over the years.
Cecilia, how about for you? Is there, from one of the great wars, an event that you would point to that say, boy, we think about that differently today than we might have a quarter or half a century ago?
I would like, actually, as a historian of mostly the 19th century, to point to another war, and that's the War of 1812 that I've spent a lot of time thinking about and writing about, and my students increasingly are interested in. And 1812 is one of those wars that was seen later in its commemoration in the late 19th and early 20th century as an affirmation of Canada's loyalty to Britain. Historians subsequently have questioned that narrative, but I would say that narrative actually does exist in the popular memory. I live in Niagara-on-the-Lake, and there's a very different take on 1812 than you will find in my academic work.
That is so true. I get to Niagara-on-the-Lake every year, and boy, if you're interested in the War of 1812, that is a fascinating town to walk around in. But I think one of the most interesting retakes, I guess, on that war I read was a few years ago, a book by an American professor who described it more as a civil war between, loyalists to Britain and those who had revolted from Britain. And that was a whole different take from the one I learned in high school. How much of that goes on in history on a typical basis?
Oh, that rethinking, that reworking, a lot, Steve. I mean, Jonathan and Arnie have mentioned that, we find new sources all the time, and the context in which we evaluate those sources also changes. So, for example, at one point, some of the historical work produced by academics said very little about women in war, women's role, both, say, as nurses, increasingly now, of course, as combatants, and also as civilians. But there has been a whole rethinking of their significance in war, and that, has been shaped by the context of second-wave feminism to no small extent.
Now, Jonathan, my assumption would be that the narrative, the so-called historical narrative of a great conflict, let's take World War II for argument's sake, would begin, August 1945. Bombs drop on Japan, war is over, and you'd think the narrative starts to get baked in right away. Did that in fact happen?
It didn't happen in this country. I think after the First World War, the narrative became so important right after the war because the peacetime years were so desperately bad. People were expecting to return to a greater country. And Canada in the 1920s and 30s was dismal and poor and small and measly. And so they turned into the narrative of the war as a way to give them some compensation for what they'd been through. After 1945, I think you can argue that Canada turns out to be generally a pretty good place. Prosperity, work for all, social policy, all sorts of government programs. Most people are satisfied with what they fought for. So they don't really need to evoke a memory or a myth of the Second World War because they're living a great future. They don't need the past at that particular point in time.
Arn, don't take this as intended to be an aggressive or chippy question, but I guess I want to know whether it's you folks who decide what the narrative is and how we, decades later, regard it.
In some regards, I'm certainly openly arrogant enough to say that it is our responsibility as professional historians, emphasis on the word professional, to have the rigor, the academic rigor, the critical thinking, and the analytical skills to entertain multiple narratives over time, right? As opposed to cherry pick history. I use that phrase all the time. A lot of people cherry pick, some professional historians too, I guess, but it's easy to construct historical narratives if you reach into a grab bag, pick the ones that you like, and then throw away the other bits. So I do imagine our job, probably naively, to be kind of protectors of that process, not of a particular truth, but to urge people to engage in these discussions critically and constantly. That's the issue. It's not just the critical part. We constantly have to revisit. As Cecilia mentioned, narratives change constantly. We put in new angles, new issues, new ideas. There's new documents that are revealed. And it's not on small things, right? It's on big things. So, the way that I was taught the outbreak of World War I is quite different than I now teach it. in World War II. And I went to Western, so here's a plug for then UWO. I was taught by brilliant historians. But the way that they taught Soviet sacrifice, the Soviet Union's war in World War II, the Great Patriotic War, very different than I now teach it. And that's not because I'm smarter. It's because we have new narratives, new interpretations. So yeah, I think historians should imagine themselves and aspire to be, the kind of ringleaders in that process, not the only determinants of a historical narratives, but certainly the organizers of it, I suppose.
And Arn, let me do a follow-up with you. From where I sit, that means you have a quite awesome responsibility. Do you feel that?
Every single day, Steve. And maybe I'm corny, but every day, and I admit it, sometimes I feel haunted is the word that I use, because I have to go into a classroom. Now it's a white dot on my computer recorded for my students, which I'm not a big fan of. But, we have to go into the classroom and convey these absolutely massively important events and issues and ideas in 50 minutes. Right. And that's an awesome task. It's the greatest job in the world. And I'm an unabashed fan of being a university prof. We should never complain about it. But it is it's quite a burden, especially given how many landmines there are out there about history, interpretations which really aren't historical, but quite personal. People bring in that stuff every day. So if you can leave class relatively unscathed in terms of that debate. And let's be honest, there's also staggering ignorance. A lot of people in the world are profoundly ahistorical. They really don't care about the process. They want to believe what they want to believe, or they don't care at all. And so that makes the job really, really difficult. And not just students, sometimes politicians and others too.
Well, on the issue of politicians, sorry, Jonathan, you wanted in on that?
I was just going to say the other thing we're all aware of is that people have so many more different sources for learning about history nowadays. And many of them aren't very good. So the number of students who come in and consider themselves experts on the Battle of Midway because they've seen the Matt Damon film, or they know all about Normandy because they saw Saving Private Ryan. We have so this is the woe is me historian thing. We have a lot of misconceptions to correct because there's so much history flying around in popular culture. So many people get so many wrong impressions about the past. You feel a responsibility to correct misinformation that surrounds historical events.
On the other hand, Jonathan, if you got something like Dan Carlin's Hardcore History, 4 or 5 hour long podcast talking about history, that's an opportunity to learn about history in a way that you never would have had 20 years ago. Gotta like
sure.
that.
And I have students who had decided to major in history because they loved playing Battlefield 1942. There are people for whom that sort of pop culture engagement it turns on a light, and they want to learn so much more, and it sets them on a path. Good to focus on the positive stories.
Okay. Cecilia, let me bring you back in here because I do want to talk about the War of 1812 again. And to that end, about the influence that politicians have in our understanding of history. I'm trying to think back now. Stephen Harper thought it was a very big deal that we learn about the War of 1812. And when he was Prime Minister, he saw to it that Heritage Canada got some money in order to make that more prevalent and present in our lives. I don't know how successful it was, but he thought it was important and he did it. What do you think of efforts like that by our political leaders?
Oh, I think you have to be very careful in evaluating those and in analyzing them. Yes, as a historian, and I would agree with everything that Arn and Jonathan have just said about our responsibilities as historians. It's always wonderful to see history in the public domain, to see it debated, to see it discussed, to see efforts being put into its representations and its pedagogy by national bodies. But you also always have to ask yourself, as somebody who studies the history of commemoration, for what purposes, for what ends, and so what kinds of narratives then emerge out of that process. History in the service of nation building can lead us down very thorny paths. And we have lots of examples around us in our contemporary context to see where what kinds of problems that might arise. I will say, though, it's interesting because when I taught the War of 1812, and of course I teach in Upper Canadian history to my students over the past couple of years, in the wake of those efforts by the Harper government, even though they still tend to see it, if they think about it at all, of course, as a kind of definitive moment in the formation of Canadian identity, they still rolled their eyes a lot when I talked about the government's efforts to use the war for particular state and nation building purposes, which I think is kind of salutary, actually, that they were skeptical about those efforts. And one of the things they would ask me is, of course, who is being included, who is being excluded, and for what purposes are these narratives being promulgated at the expense of others, too? Mm-hmm.
Well, one of the things, of course, because we couldn't gather in ways that we normally do on this day, or did on this day, we couldn't talk to soldiers today, not in the ways we could in the past. You couldn't just be at a Remembrance Day ceremony and speak to men in their 90s or women in their 90s, some even older. And I guess I want to, Arne, why don't you start us off on this? Once they're all gone and the day is coming, how is that going to have an impact on our understanding of what we're talking about here tonight?
Yeah, it's going to be a very different process of commemoration, for the obvious that we won't have that shared experience. We won't have the opportunity to see and to meet individuals that endured these enormous crises, and to get to see them as people, which I think is really elemental in education, right? As opposed to a history book or a TV documentary, you get to meet them, they get to hear their stories, their sense of humor, their passion, their loss. That's always been extremely important for me, and I've spent a lot of time, with veterans and learning from them. That's lost for sure, and that's going to be a sad day for us all. The only, I suppose, positive note is that there is, especially with respect to the Second World War, there are, of course, a lot of archival documentary sources that we have to try to keep the life alive. So, this isn't like the Punic Wars or War of 1812, where we've lost, basically the only repository that we had. Here we have other opportunities to try to keep those memories alive. And that's certainly where I think we have to turn our attentions next. And hopefully we will.
Jonathan, how long can we remember if they're not around to help us remember, to be that living symbol of what we need to remember?
The simple answer, Steve, is that we can remember as long as people are willing to put in the effort to help us remember. Memory doesn't go on forever unaided. It needs to be fed. And I think as long as there are groups and individuals who want to keep those memories alive, then we'll continue talking about this. And I think about the time sort of 10, 15 years ago when the last of the First World War veterans were passing away, and we were down to 6 and then 3 and then 2. And the big question then was, well, what happens when all the First World War veterans are gone? Do we stop remembering? And I think what we saw is countless amateur historians, local historians, people for whom it was a hobby, took that seriously and said, look, if they're all gone now, I'm going to take up this subject and make sure these memories aren't lost. And so we saw a flowering of local histories about communities in the First World War, which was, I think, really positive and really powerful. So I can see that happening again in future, and that sort of thing can go on almost endlessly, I think.
Well, Cecilia, let's for argument's sake take the other side, which is, what do we stand to lose if we don't remember?
Well, I think on a very basic level, Steve, we stand to lose our humanity. Remembering whether it's war or whether it's other historical events, processes, or people is part of, I think, what makes us a society. It anchors us. It gives us a sense of place and time. And it also gives, I think, us a sense of not just difference over time, but kinds of deep perspectives that we don't get often in today's culture. So it gives us a sense of what people have experienced in other times that can make us put our own immediate experiences in a different kind of context. And gives us a feeling of being able to, think more broadly and feel more broadly too, because remembering is also about affect. It's about emotion, as much as it is about, our analytical tools that we use as university-based historians.
Arne, is there something in your view that we should be remembering that you fear we are either starting to forget or have already forgotten?
Lots of things. I mean, obviously, I would like people to entertain particular facts as opposed to just, sort of opinions. That's something that, we caution undergraduates in particular on every day. But really, to echo my colleagues here, it's fundamentally about respect. And I think if we lose interest or lose the capacity to remember, and maybe it's performative remembrance, right, in the sense that we show up at a cenotaph, we go through a ritual, we go through tradition. But I've never, imagined it to be limited in how we remember. It's an invitation to remember as you personally see fit, whether that's soldiers who sacrificed in the Great War or the Second World War. You could conceivably remember all peoples who suffered in war. And so it keeps coming back to the central question of empathy and respect. And for me, it's nothing more. I get very upset, as people I'm sure will tell you, when people say this is about glorifying war and it's about, just about white Canadian soldiers in battles I've never heard of and stuff. That's never been the point to me. It's about respect, in the same way that if you go into a church or synagogue or a temple, you show respect. In the same way that you're expected, not to have a dinner party at a graveyard. It's a basic issue of fundamental respect. If we lack that and we lack empathy, then I just don't really see how we function very well as a society in the contemporary, let alone craft identity.
I remember being near Vimy in 2017, the 100th anniversary of the battle, and seeing engraved in marble walls Sikh brigades, indigenous brigades. I mean, yes, the notion that this is just somehow a white man's war is obviously not true. Jonathan, I should get you to comment on what you think we stand to lose by forgetting.
I think we in addition to what Arne and Cecilia said, I think we lose the perspective of our place in the great scope of history. I mean, one of the things that teaching history does for me is it makes me endlessly grateful to be alive today, as opposed to in the 1940s or 1910s when I don't have to go off to war, or my kids don't have to go off to war. I think history reminds us how fortunate we are to be living in the world we're living in, although it's difficult to accept that in times of COVID restrictions. But it also teaches us not to be cocky. Not to be smug, not to think we've got it all sorted out, because we don't. And one of the things that I always tell my students is think about how a historian in 200 years is going to look at us now. Are they going to be impressed, or are they going to be a little concerned about this society? So keeping a sense of history is a great way to remain humble. Which I think is a quality we can all use a little more of these days. Mm-hmm.
Cecilia, let me get your take on this. I've got a friend named Jerry Emmernick, who's an author and spends a lot of his time going into schools. Well, I guess not going in so much, doing Zoom hits now in schools these days. And I know he did some today with schools, because he's mortified at the fact that there are probably 1 student in 10 that know what the Holocaust was, or 2 students in 10 who can tell you who the combatants were in World War II. He's mortified by this, and he wants to get into schools and tell young people about this. What's your take on the fact that young people today, well, I don't want to blame them, but let's just put it this way. They don't seem to know a heck of a lot about what happened more than 10 minutes ago.
Yeah, it's a very good question, Steve. I would say, though, that our concern over youth and their lack of historical knowledge is not a new one. You can hear this same kind of concern earlier in the 20th century, in the 19th century. It's not new, and I think, I certainly admire the work that your friend is doing, but I would also say we don't always ask our students sometimes, what do they know? So they, and I certainly agree. They certainly know what the Holocaust involved and what Auschwitz was, and those sorts of elements. But at the same time, I would also like to know what is it that they do know. Do they have other histories that they bring into the classroom, and do we not ask them about that? So that would be my general thoughts on that particular matter.
Arne, let me get you to follow up on that in relation to a story that you told our producer Eric Bombacino about concentration camps and your experience there.
Yes, I've taught in Berlin several times, and as part of the curriculum there, I've taken students out and family and friends out to Sachsenhausen concentration camp, and many times. And usually it's a fairly routine tour, as routine as you could describe a place like Sachsenhausen. But quite often I find tourists who show up and have food on them and proceed to eat the food, bags of chips, cans of Coke. Not just in the camp in general, which is hideous enough, but in particular in the last existent barracks where Jewish people were interred and executed. A woman proceeded to have a lunch on the shoe track, the infamous shoe track where prisoners were hobbled before being executed. And I've taken it upon myself to take photographs of them to show my students, in very graphic fashion, because I can be quite graphic, as a reminder of, I think, what Jonathan said, right? How arrogant we can become, how detached. And I'm merciless because you don't go to Sachsenhausen, by accident. It's not I'm stumbling into a concentration camp. You make a decision to get on a train, walk through the town, go to this place. And yet still you have the presence of mind to be so utterly and obscenely detached from history. And you think this is now just a sort of, check box. I've been there, done that. I've seen the same thing in Tuol Sen prison in Cambodia, where at the end of this monstrous place where people died en masse, somebody graffitied their name, I was here. And I cried, and I show images of these things to my students because to me that's the obscenity. But I like what Cecilia said. It's important to engage our students, ask them what they know, what they care about, and Jonathan hit it right on the head. I've had students too that say, I got into this because of a video game or because of my great grandfather or an image that I had. So I grew up with World War II. My parents fought the war, and so I was steeped in it. That's no longer obviously the case for our students. So it's our job to find other ways to engage them. And however you get them in, I'm a bit shameless, right? Used car salesman here. However you get them in, and then you learn them something, right? And that's the whole idea behind it. And I'm very grateful that a lot of students are very interested in history, and we just need to connect. We need to shake them and make them understand that they too were part of these events, even if it's not immediate obvious.
Jonathan, maybe I can get you to follow up with the story of a meeting you had with a retired Air Force guy who was talking about his experiences with young people?
Yeah, this was a fellow I met years ago. Would have been in the late 1980s. He had joined the Royal Air Force in the interwar period, served through the Second World War, and up until retirement in the 70s, his brother was killed in the Second World War. And we were talking about the youth of today and in the 1980s and whether they have a sufficient understanding of their obligation to the community. And I made the point, which seemed brilliant to me at the time. Well, kids these days, they don't understand what the world is about. They wouldn't sacrifice for anything. They're lazy. They're self-absorbed. They're not interested in anything 10 feet around them. I think if there was another war, we'd all go to pieces. And this fellow's response was fascinating. He said, "Well, that's exactly what we said about kids in the 30s. That they were selfish, they were self-centered, they were egotistical, they didn't care about anything. And yet, when push came to shove, and there was an evil enemy that had to be met and defeated, they turned out in massive numbers to volunteer and to essentially put their lives, their future, on the line. And so I think it's hard to predict what our society is going to do in any situation, but that his response kind of took me down a peg or two.
Well, I guess my response to that would be they didn't have smartphones in the 1930s, so that's one thing. But on the other hand, we have seen, that's a bit of a smart-ass comment, admittedly, but in the course of this pandemic, we have seen all sorts of people who we might not have originally thought all that much about, really rise to the occasion in some pretty spectacular ways. Not just frontline healthcare workers, but people who stock our supermarket shelves and who get on bicycles and deliver meals to us and all of that kind of thing. So, Cecilia, maybe there's something to what Jonathan said there. What do you think?
Oh, yeah, I would agree. I mean, there have been countless examples of people, the supermarket shelf stalker, the courier, the people who work in hospitals and particularly in long-term care homes, who we know have had an extremely difficult, sometimes awful time during the pandemic. And just to sort of go back a little bit to, the youth of today, what I think of as a bit of a trope, think about the environmental movement that was flowering, at least, in the streets before the pandemic struck. And think about the youth who have also shown up at Black Lives Matter protests as allies for Indigenous people. So, I guess I always sort of caution like that, it's sometimes very tempting to say, the smartphone and the terrible things it has wrought and the individualism that seems to pervade our society. But I would say my generation can be just as guilty of those, qualities as well.
No, fair enough. Arn, I'm down to my last 30 seconds here, and we touched on this ever so briefly. Maybe I can get you to finish up on this. There is always a danger of glorifying war on a day like today. Do we have to be careful of that?
Sure. Short answer is sure, we do. But I would always caution people, there's nothing inherently wrong with commemorating individuals who fought war or who continue to serve in our armed forces for various reasons, because they do a very important job. They have done and they continue to do a very important job in safeguarding values and ideas that we all cherish, even if sometimes we disagree over interpretations of them or events. So certainly for 2 minutes every November 11th, can we put that aside and understand the tremendous sacrifice that people in the past made, with their lives? I have no problem with that. And then, of course, go back to our very enjoyable lives and to be so grateful, as Jonathan said, that we weren't there in Vimy Ridge, Stalingrad, all of these places. So, I don't think it's that much to ask of us all to actually acknowledge that particular suffering, in addition to all the other remembrances that we can do.
Gratitude is a great place to leave this, and we are similarly grateful to the three of you for sharing some of your Remembrance Day with us today. Jonathan Vance, Cecilia Morgan, Arn Kislenko. Hope you all had a very meaningful Remembrance Day, and we're thankful that you could spend some of it on TVO tonight. And that is the agenda for Wednesday, November 11th, 2020. We hope it was a meaningful Remembrance Day for you and yours. For kids across Ontario, this school year is unlike any other. Tomorrow, we'll check in on how it's going for those not attending in person, but learning in virtual schools instead. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.